So basically, if you are doing a cataract surgery, the idea is that it was earlier a restorative surgery. That means that a person who has lost his vision because of cataract, person is seeing very blurry, there is diminution of vision, there is quality of vision is bad, contrast is bad. One would take out the cataract and replace it by an intraocular lens so that a person is able to see clearly with the need of glasses in the post-operative period. So therefore, cataract was earlier a restorative surgery. Today, cataract surgery, apart from being restoring the vision, that means that being a restorative surgery, it is also turned into a refractive surgery. What it means is that because of the advances in cataract surgery like the femtolaser assisted cataract surgery and the advancement in the intraocular lens power calculation, that means that you are able to predict as to what should be the lens that should be used in a person so that the outcomes are such that a person does not need glasses for distance vision for after a cataract surgery. The newer advancement still is that there are now lenses which are of the category of bifocal, multifocal, trifocal lenses or extended depth of focus lenses. This gives a continuous range of vision to the patient, and therefore the patient may not need glasses or the dependence on glasses for both near and distance, as also having a complete range of vision of the intermediate distance is taken care of while doing cataract surgery and implanting these premium presbyopia correcting intraocular lenses.
Follow Planet LASIK and post your queries to get answers from the experts.